So we've talked about the specializations and the certifications. Where do you think the field of speech language pathology is going?
Since I've been an SLP, I see a big push towards using AACs, not just for long-term users, but kind of kids through early intervention, and they might be kids that don't use a device long-term, and kind of having the stigma of being a device user going away or minimalizing to where like we're using this as a tool and not something that's only used in last resorts, where I think that's kind of a block that I had as a professional when I started, was that when we had kids that were completely nonverbal, I would go, okay, this is we need something so that they can communicate, where if they were using some words, we'd go, okay, well, now they're a language user and we use that. And thinking of it very black and white. And I'm seeing through professional development and things like that, I'm seeing a big push towards using these devices more as a tool to build language and total communication, whether that be sign language, verbal language, using the AAC, and just building their language as a whole.
So for anyone who doesn't know, AAC is
Alternative augmentative device.
Yeah.
It's a device. Sometimes it's like literally an iPad, and sometimes it just kind of looks like a really thick iPad.
Yeah.
And they have different icons with words on them that kids can navigate through, and it's really incredible. Like when you watch a kid scroll and find the word, it's amazing.
Yes. And you can strap it on and take it with you everywhere.
Yeah.
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 And you can personalize the devices too.
Yep.
Yeah.
So if you have a kid that's like eats, I don't know, Cheerios, you can just go in there. There's a camera on most of them. You take a picture of their Cheerios, you add it into the device, and then they can scroll through there. They have all their foods. They see their Cheerios. Bam.
Boom.
Give me
Now I'm
those
thinking about
Cheerios.
cereal.
Yeah.
Oh, yes. And you can do like pictures of like family members and all kinds of things.
Yeah, there's like clip art type icons for a lot of the things, and then you can also take pictures of the actual person, place, or thing.
I tell parents a lot, like what a like amazing time when to like if your child is going to have or be diagnosed with some kind of like delay in like speech or development. What an amazing time to have access to all of these things that we have and the services that we have. This was not something that was at all available like when I was going through grad school, and to be able to personalize it and customize it so that it's so specific and it's can be utilized by a child in such a very like personal way.
Yeah, I don't have really anything to add to that. You kind of hit the nail on the head. It's amazing.
It's amazing.
Yeah.
And you can, I feel like as a professional, like it makes you feel like, gosh, like what an awesome like ability to be able to give this child to help them have a voice.
And to the families, like there's so many families that are just, they're frustrated because they know that their kid is understanding things, but they're just not talking. And a lot of families feel like, gosh, I know that they can do this, and I know that they know what they want. I just don't know what they want.
Yeah. I see that a lot, like when we're doing evaluations and we're doing like IQ testing. I wish so much that we could have some normative data for AAC users and alternative language users, because that would be so special, because I see the same thing. It's like the expressive language is just not as developed as the receptive language, which Dr. Walden told me that would be the case when I had my first child in grad school. Watch your language. Receptive develops before expressive.
Yeah.
But I mean, like there's so many times where I feel like I know this kid wants to communicate or wants to tell me, and they just can't quite find like the word.
And then oftentimes that leads to frustration, understandably so, because they're not able to get their needs met. And then there are behaviors that's kind of what people focus in on are these behaviors when the root cause of that a lot of time is a lack of language.
Yeah. And it's
And
just a communication issue.
it is super frustrating. I sometimes I'll take like the trial devices home, and with my fiance, I'll just go through and try to communicate exclusively with a device. And it's frustrating, like the time that it takes to scroll through, and I can't quite find the icon that I'm looking for. And I know it's not like a one-to-one, but you kind of get a glimpse into that frustration of knowing what you're trying to say and not being able to get it out into the world.